Hi there, welcome back to my channel. Today we'll be having a chat with Dr. Prashanth, a leading pediatrician from Cloud9 Hospitals, because right now there's no COVID vaccine for children. So would it still give some kind of a protection if we give our children a flu shot as opposed to a COVID vaccine?
If you want me to answer in one line, no. So COVID is not the vaccine directed against COVID. The influenza is not the vaccine which is directed against COVID. So to begin with, we heard, we read, we saw people taking BCG vaccine telling that it's going to protect against COVID, like this. So facts about it is, flu mimics almost like any other respiratory infection like influenza. It is going to mimic same like a COVID infection, or for that matter any respiratory infection. Now with the pandemic in background, we don't want to mix up the things. So influenza vaccine, yes. So as such, we recommend for every child till they become 5 or 6 years, yearly once, especially during the just before the rainfall, the monsoon season, because this seasonal change and the seasonal influenza can affect kids badly. So we want to protect against them. Now what we are trying to, people are trying to do that is by giving flu vaccine, you want to avoid confusion whether the child falls sick. We don't want to have one more enemy which is already there. The COVID is there, which is going to affect, and we don't have one more unwanted guest like influenza affecting the kids more and more. And it is also, once the child develops a severe flu, the child will be in a transiently in an immunodeficient state. For few weeks, child will be prone for a secondary or a superadded or a opportunistic infection. So we don't want to put the child in a situation wherein the child will be prone for an second infection. So considering these factors, yes, flu is recommended for the kids. Irrespective of COVID, it has been recommended by Indian Academy of Pediatrics for all the kids seasonal flu yearly once till they become 5 to 6 years. Yes, but flu is recommended, but it's not the vaccine against COVID.
We don't know when children in India will be able to get vaccinated against COVID. Hopefully, it'll be soon. Some parents had asked whether taking a flu vaccine now will react adversely with the COVID vaccine their child might get later. I did check with Dr. Prashanth on this, but he assures us that there is no such issue. We just need to give a gap of 4 weeks between the flu shot and the COVID shot, as is the normal practice. Many of the people I talk to, whether it's from my friend circle, relatives, or even others, are very scared to take the vaccine because many of them feel that this vaccine has not been researched enough, or the fact that it came out in just a year or less than a year, as compared to most of the other vaccines which take around 7 to 8 years to research and get through all the trials and then get released. Are their fears valid, doctor? Do we need to be worried about this? Or should we be just queuing up at whatever place it opens up and just go and get our shots done? What is your take on this?
See, with regard to vaccine, we have a lot of poor acceptance, a lot of concerns, fewer genuine, fewer, more of exaggerated kind of a thing. Yes, all of us know that, these vaccines were prepared in a very record quick time. So obviously there are concerns about the long-term safety, long-term side effects. Is it going to harm our body, whether for time being, or it will have some impact in the long run as well. So all these things are there. Yes, all are genuine concerns, but we always work in a way like, the risk and benefit ratio. For example, if I'm taking any medicine, even for the simplest of paracetamol, so we always check what is the benefit of that taking medicine and what is the risk associated with that medicine. If benefits outweigh the risk, then definitely we should go for it. So whatever it is, whether it's paracetamol or any trial medicine, or for that matter, even simplest tasks also what we do on a day-to-day basis, if benefit of that thing outweighs the risk, then definitely we should go for it. Yes, we have done tens of crores of doses as of today. So it has been proven to be very safe. So people shouldn't have hesitancy in taking the vaccine. This is the only way we are going to protect ourselves as well as the community. Yes, the rare people keep worrying more about the clotting phenomena, this, that and all. But when you see, the chances of all these things are very, very, very marginal. So the chances of having a clotting when you are undergoing some illness, or when you are bedridden, or when you are, for that matter, when you are pregnancy or post-pregnancy, that is much larger than the clotting phenomena associated with the vaccination. So one issue here and there shouldn't deter us from going ahead with the vaccination, because that's the only way go ahead for all of us to get rid of this pandemic. Okay, so I encourage everyone to go ahead and take the vaccine as and when your turn comes.
Usually, kids are the ones who get most of the vaccines. But for this vaccine, they were tested the last. Why is that? Is it because of some danger that is inherent in this vaccine?
No, not really. It's not that way. So it is relatively, the virus is an older one, but it's relatively a newer disease. And none of us had much of an experience. And going by whatever the evidences we are getting and all those things. So it was affecting mainly the age-old population who are with comorbidities, affecting more and more. So the focus was more on them. So whenever a new medicine comes into the market, or new things get into the market, they go by the evidence. What is the safety? We are always concerned about the safety of the vaccine rather than the effectiveness. Effectiveness is definitely yes, but safety is a bigger concern. Now here, when the vaccination trials were started, it was mainly intended at healthy adults, and then they started from phase-wise manner, like above 60, 45 to 60 and all, because this disease was predominantly affecting this population, and they were the one who were suffering either the major morbidity or deaths. So why it was focused more and more on them. So apart from that one, I don't see a major concern. See, already we have vaccinated close to 25-30 crore doses, and you don't need any bigger evidence than this that it is safe. So most of the times we do say small numbers, like when we gave in 10,000 population, it was found to be safe. 20,000 population, it was safe. Now we have a country who has vaccinated like this number, large number of people. 25-30 crore doses have been done, and we have not seen any serious side effects. So I don't see any danger involved in the vaccination, but yes, so it has to go through the process. Once we find a slightly long-term safety of this vaccine in pediatric age group, like most of the countries have started trials, in India also trials are going on. Hopefully we'll have the results sooner, and we should be able to start vaccinating for our kids as well. But like I was telling, one is the effectiveness, definitely we want it, and at the same time we want it to be safe as well, isn't it? It's not just having something that is going to carry a significantly higher risk compared to the benefit. So it's always the risk and benefit balance that we want to maintain. So with that regard, yes, definitely we want to wait for the slightly more data in pediatric age group before we actually start vaccinating in a larger population of pediatric age group.
Now, lactating moms are also eligible to take their vaccines. Does this have any kind of a bad impact on the baby, or does it give any kind of a protection for the baby?
People keep asking, should I take? I said yes. I keep saying, please take it. One, it's going to protect you. The second thing is, it's going to protect your baby, if not directly, or not transmission through the breast milk, or whether the baby is getting benefit because of mother's vaccination through the breast milk. But yes, definitely the chances of your baby getting infection is more likely from you only, isn't it? So one of you at home is likely to give the infection to the baby. If everybody at home is vaccinated, the chances of, because baby is not going into community, not going out and playing or coming, so the indirect protection is definitely there. There's a small evidence to say that the antibodies generated, whether they cross breast milk and protect the baby. Yes, till we get larger and larger evidence, all that we know is it's not harmful. It's gonna protect the lady for sure, and likely it will protect the baby as well. So please, all the lactating mothers should be encouraged to take more and more vaccination from the corona. So as far as lactating mothers, they keep asking, I'm going to plan for vaccination, should I stop feeding, is it gonna cause? All these things are myth. No, you taking vaccine is not that the thing will go to the baby and cause harm to the baby. So please don't stop feeding. Even someone who is naturally infected also is not supposed to stop feeding, unless you yourself are so sick that you are not able to feed the baby, or the treating physician says he's using some medicines for you which might not be very safe with the feeding. Only those situations you stop feeding. So technically feeding is always an yes, whether you are getting infection, whether you are getting vaccine. In all the scenarios, feeding is always a big yes. So feeding is going to prevent so many diseases, having so many advantages to the baby as well as mother. So don't ever think of stopping feeding on your own just because you are infected or just because you are going to take vaccine, unless your attending physician says it is not safe. So please make sure you continue to feed. It's going to have a lot of benefit to you as well as your baby. See, these are all high risk population. The first half of the pregnancy, when they get affected, we have still no great evidence to say that it will have a teratogenic in the sense something that affect the baby. So we don't have any evidence. Same is true for vaccine as well. If you vaccinate in the first trimester, is it going to harm the baby or the mother anyway? So we don't have an evidence. But yes, as and when the infection happens at a later date of pregnancy, not just for COVID, for any infection, the chances of transmission to the baby will be very, very high. So the chance of preterm birth is proven to be slightly high when the mother gets infected with COVID. So there is an urgent need to vaccinate pregnant ladies.